Hi there, welcome to Chapter 5 Medical Terminology. We're going to do a brief overview of why it's important to understand and use medical terminology in the EMS profession. We like to go over the National EMS Education Standard that you have to adhere to make sure that you're getting the information that you need in this course. So medical terminology uses foundational, anatomical, and medical terms and abbreviations in written and oral communication with colleagues and other healthcare professionals. EMTs need a working knowledge of medical terminology, and there are some specifics you need to understand: key terms, acronyms, symbols, and abbreviations. We will determine the meaning of an unknown word by understanding how the terms are formed and learning the definition for parts of a term. Understanding medical jargon leads to effective communication, both verbally and in writing. An example of this is when you would take a patient to the emergency department and have to turn over a patient to a team of physicians, nurses, and technicians. Medical terms are made of distinct parts that form specific functions. Changing or deleting any part can change the meaning of a word. Components that comprise a medical term or a medical word include the following: a word root, a prefix, a suffix, or combining vowels. And we'll have examples of these for you. So how the parts of a term are combined determines its meaning. Accurate spelling is essential. Please use spell check or have partners go over your charts to make sure that you are spelling the correct word the correct way. For example, phasia, P-H-A-S-I-A, means speaking. Phasia, P-H-A-G-I-A, means eating or swallowing. You can see how you could miscommunicate information if you use the wrong word or spell the word incorrectly. D-Y-S, means painful or difficult. So dysphagia with an S means difficulty speaking, while dysphagia with a G means difficulty eating or swallowing. So make sure you know which one you want to use. How the parts of a term are combined determines its meaning. Also important, knowledge of anatomy and the context of how words are used. Word roots are the main part or stem of a word that conveys the essential meaning and usually indicates a body part. And again, we'll have examples of these for you. If you add or change a prefix or suffix to change the meaning of a term, it can change the meaning of the word. So cardiopulmonary breaks into: cardio means heart, pulmon means lungs. So during CPR or cardiopulmonary resuscitation, you introduce air into the lungs and circulate blood by compressing the heart. So this should make sense to you when you break down cardiopulmonary. Prefixes appear at the beginning of a word. They usually describe location or intensity. They're also found in general language. Here are some examples: autopilot, submarine. Not all medical terms have prefixes. They give the root word or the word root its specific meaning. So for the root word pnea, P-N-E-A, one can add the prefix a, apnea, brady, bradypnea, or tachy, tachypnea. So each of those words, let's go back. If we say apnea, that means without breathing. Bradypnea means slow breathing, and tachypnea means rapid breathing. They all mean very different things, but you can guess what you're talking about if you know the root word. By learning commonly used prefixes, you can figure out the meaning of unfamiliar terms. Suffixes appear at the end of words, and they usually indicate a procedure, a condition, a disease, or a part of speech. Look at an example. So commonly used suffix here is itis, which means inflammation. If you pair that with a root word, arthro, that means joint, and you say arthritis, that means inflammation of the joints. When you combine vowels, it connects the root word to a suffix or other word root. In most cases, it's an O, but it may be an I or an E. Let's see what we mean. So they're used when joining a suffix that begins with a consonant or when you're joining another root word. So example, let's look at this one. Gastroenterology. So you have gast with an O, enter with an O, ology. So gastro refers to stomach, entero refers to intestines, and ology is the study of. So gastroenterology is the study of the stomach and intestines. A combining form is when combining a vowel shown with the word root. Some common combining forms are cardio, gastro, hepato, arthro, osteo, and pulmono, and we saw that earlier with cardiopulmonary. So here's a summary. The prefix is at the beginning of a word. The suffix is at the end of a word. Use a combining vowel when the suffix begins with a consonant. This helps ease pronunciation. Or a term has more than one word root. So again, cardiopulmonary is a good example of that. Plural endings, sometimes you have to add an S to make words plural, and sometimes you're changing it differently. So words ending in A, you may change to AE. So vertebra is singular, vertebrae is plural. Diagnosis is singular, diagnoses, plural. EX or IX to ICES. So apex is one, apices is multiple. ON or UM change to A. So ganglion is one, ganglia, plural. Ovum, one, ova is plural. US, you can change to I, so a bronchus is a single and bronchi is plural. So we're going to stop there because you guys already had an overview of prefixes and your instructor will go over more. Thanks so much.